Hello, everyone. Good evening, good morning, good afternoon, wherever you are. I trust you're doing well. So it's Stevie MD's ECG workouts again. So today we bring you an interesting ECG case. So let me just share my screen and then we would start working on it. Okay. Right. So this was a case that I got from a friend of mine, a colleague doctor of mine. And so it was a 45-year-old male who presented with heart palpitations, episodes of heart palpitations and dizziness over the past 2 weeks. And then the episodes were random, not related to any physical exertion. He recently completed a 10-day course of fluoroquinolone antibiotics for a UTI. And then, while his past medical history was unremarkable, there was no history of cardiac disease, vitals were normal, cardiovascular neurological examinations were also unremarkable. Now, the lab tests, including electrolytes, thyroid function tests, were all within normal. Then they did an ECG, and then it was sent to me for a second opinion. Right. So this is it, and let's blow it up and then see how we can examine it carefully. Okay, so going through the normals, the basics, you know how to go about it, looking at the rhythm, the rates, and checking your waves, your intervals, and all. So when I got this, I quickly picked it up that this is a sinus rhythm. Of course, every P wave in front of every QRS. Okay, so that was just it. Let me pick up my pen and then we would continue. Um, so which color should I pick? Okay. So then let's go for this one. Okay, so yes, I I would I quickly go to my second lead or the lead two, and I check and I look and I watch out for any abnormalities. Okay, so yeah, there we see in V1 also. Oh, where's my pencil? Okay. So in V1, okay, you can see, okay, um, what do you see? You can take a pause and then just think about it. Look at this ECG carefully, because it's a bit tricky. So you need to look at it very carefully, okay? You need to look at the intervals, okay? Look at the QRS complexes, the ST segments as well, okay? So first of all, this is a sinus rhythm. I don't know why my pen is not giving me a thick. Why? I want a thick one, please. Okay, so let's move on. So like I said earlier on, so what you see, it's very tricky. You should really look at it carefully. So when you look at the ST segment here, right? The ST segment is a bit elevated when you draw, on the isoline. It's slightly elevated ST segment. So you can see that, right? So that was for V1, and then V2, I think we're having slight elevation as well. You can see that you can pick that up. So this will be a septal MI. Okay, this would be a septal MI here, right? What else do you see? What else can you find? So we found the ST segment elevation, the sinus, is a sinus rhythm for us. Then what else? Hmm. So I looked at it carefully and I realized that, okay, then again, you're having the T waves are inverted, okay, T wave inversions, right? T wave inversions, okay. So I looked at it carefully and I was seeing, um, I realized that the QRS, the QT is prolonged. I don't know if you can pick that up. I don't know if you can pick that up. The QT is prolonged, right? So um, that is going to be part of our diagnosis. Okay, it could be that this patient was suffering from a QT syndrome or a QT prolongation. Okay, so we have to analyze it quickly. So how do we go about that with a QT prolongation? So you know the QT interval, it's from the beginning of the Q, right? Right to the end of the T. Okay. So this interval here. And this is I mean we're gonna go talk about it in details, but a quick way to do that is to count the number of boxes. Okay. So if the boxes, the very smaller boxes, you count them, and then you would have to multiply that by 40 milliseconds, right? Or with these large boxes, you count the large boxes, and then you have to multiply it with by 200 milliseconds to get the QT interval for you to know that it's prolonged or it's short. Okay, we have the long or the prolonged QT or the short QT. So this one is, I mean, we're having almost like three boxes. Okay, so this would be like three boxes, and then you multiply that by um by 200. Okay, then you're going to get like more than the normal, which is in males. Okay, so we have the normals for both males and then females. So for men, a QT interval of more than 450 milliseconds is considered prolonged. And if it was a woman, then that would be 460. Okay, so this is way prolonged. So seeing that, I just picked that up, tried to calculate it using the grid. But however, there's a formula they use to calculate it, right? And that is called the Bazet's formula. Okay, they use the Bazet's formula to calculate what we call the QTC, the corrected QT interval. Okay, so we will talk about that in a moment. So this was what I also picked up. So that was the prolonged QT going on there. So yeah, if you couldn't pick that up, yeah, the next time you have to examine the QT as well. Okay, the QT intervals, do all the analysis step by step, and then you'll pick that up here. Okay, so this was the case of a QT prolongation. Okay, and then we have a sinus rhythm, the QT is prolonged, and then we have signs of ischemia. Okay, then probably we also seen the ST elevations, which could which in V1, V2, which shows a septal MI going on in there. Okay, a septal MI going on there. A septal MI going on there. So let's learn about what the QT prolongation is actually. So yes, like the diagnosis, I said this is it. The normal sinus rhythm, we have prolonged QT, and then we have the septal MI and the T wave abnormality, which is consistent with a diffuse um, ischemia, right? Okay, so this is it. You're just very easy to pick up if you really went through. If you're going to go through with the basics, the steps to analyzing the ECG, you check all your waves and your intervals, you would pick it up. Okay, right. So now, what is the QT prolongation that I was talking about? So QT prolongation, this is just a summary. It actually refers to an extended QT interval on the ECG, okay, which indicates a delayed heart repolarization, okay? So actually the QT interval, it represents the time it takes for the heart's electrical system to depolarize and repolarize. Essentially, the period from the start of the ventricular depolarization, which is where the beginning of the QRS complex, you know what the QRS complex stands for. So from the beginning of the Q, okay, to the end of the T wave, which is what? The ventricular repolarization. Okay. And then we're saying that the normal in men is what? Up to 450. Okay, in some books they say 440 millisecond, and then in the women it's what? 460. Okay, but there's something we call the corrected QT interval. Okay, why do we have to use this to calculate the QT? So this is because the QT interval itself, okay, from the beginning of the Q RS complex to the T, it varies with the heart rate. Okay, so we use the corrected QT to adjust the QT interval for the heart rate to provide a more accurate measurement. So the Bazet's formula is used, and the Bazet's formula is the QT. Okay, let me see if I can put that here. So the Bazet formula, okay, let me just is a QT interval. Is a QT interval just a moment. I don't know why it's giving me a smaller. Okay, so it's actually the QT interval or the QT over the square root of the RR intervals. Okay, okay, so I think I'll use it like that. Oh yeah, you can just jot it down because I don't know why my pens and these things are not working today. So that would be the QT over the square root of the RR intervals. Okay, the square root of the RR interval in seconds. and just that's it. But I mean, when you have an ECG like this, or you are in emergency room and the patient is brought to you, you're not going to put on a pen and do that. That's going to delay. So the quick one is what I showed you to actually look at examine the QT, okay, and then count the number of boxes in between, multiply by 40 milliseconds if you're using the smaller boxes, and then if you're using the bit larger boxes, then you do that multiply by 200 milliseconds, okay, to get the QTC. Um, I mean, for you to know that it's prolonged or not, okay? Right. So that was that for, I mean, the how to calculate it from the strip and also using the Bazzet's formula. Now, common causes could be can be congenital, like the long QT syndrome, which is a genetic mutation, and then it could also be acquired using medications like the anti-arrhythmics. Okay, the anti-arrhythmics. Using these anti-arrhythmics, for instance, amiodarone, or the class 3, okay, the amiodarone, the sotalol, the procainamide, which is what class 1, and then the quinidine, which is also class 1. Okay, and then we have the antiemetics, the ondansetron, ganzitron, granititron, and the likes, and then opioids as well, the methadones, okay, antihistamines, the diphenhydramine, hydroxyzine, and then the antimalarials, so the chloroquines, hydrochloroquines, and the you know immunosuppressants like tacrolimus, etc. So we have to also um, be careful what uh, the case might be. And then we have electrolyte imbalances, okay, as well. And then conditions like hypothermia, MI, and hypothyroidism could also do what? Cause it. So that comes here. That brings my mind to the question. The question said that this patient completed a 10-day course of fluoroquinolone antibiotic. So can you relate that as being the cause of the QT syndrome? Yes, this was a cause. This was what caused it, actually. Because why? All the vitals were normal. Cardiovascular was normal, meaning that, there was nothing really remarkable. Actually, for the septal MI, I mean, even based on the age, we were really in doubt. Okay. Okay. So it could be or could not be. But I mean, physical exam, this was just a physical examination. So this is what the exam that was done, and the labs show that the thyroid function was normal, but we just read that in hypothyroidism, we find what the QT could also be prolonged. Electrolytes were also normal, which means that this was not a case of a hypokalemia, hypocalcemia, or hypomagnesemia. In most of the cases, it could the cases that we encounter sometimes is the case of what hypocalcemia and hypomagnesemia. Okay, so and you have to also know that the importance of this prolonged QT is that it could lead to what we call the Torsades de Pointes. Okay, the Torsades de Pointes, because actually the prolongation gets further, hits on the the other I mean the other waves, like when it's not hitting on the right wave, they tend to escalate the disturbance, or the arrhythmias. Okay, so patient gets what we call the torsades, and then could finally enter into a VFib, and then sudden cardiac death would ensue. Okay, so what then can we say? So, in order um to check in order to check, like I said earlier on, so you have to measure the QT on the ECG, correct for the heart rate that they're using the QDC, um, the QT correction, and then you compare the values to the normal. Okay. So what we normally do in management of such patients is to what? To review their history and then adjust the medications. Like in the case of this patient who was on the fluoroquinolones, we just have to stop the fluoroquinolones, correct all electrolytes if there is, and then monitor the heart rate as well. Consider beta blockers or ICD in high risk patients. Okay. And then, for preventive measures, you have to monitor regularly, do regular monitoring, and then make sure that genetic testing for congenital LQTS is also done. Then, yeah, educate the patient on arrhythmia, and then the same thing so that anytime they encounter, such symptoms, they can just quickly call the ambulance. Right. So the take-home point is that QT prolongation is a serious condition and it should not be taken lightly at all. Okay, so this was a very interesting and very tricky case that was brought in. So that is that for today. The take-home point I've said, make sure that you screen very well, screen the ECG strip very well, and then analyze every wave, intervals, rate axis, everything. Okay, you don't have to be in a rush like I do sometimes. Yeah. So that was that for this case. Well, like I always do, we solve a case and then, you know, we take a break and then we breathe on and then we continue the next day. So that will bring us to the end of today's case. Okay, today we had to just solve this question or this case, and then yeah, so that we can retain what we have learned. We don't want to put a whole lot of things in our heads. Okay, just step by step, and then we'll be good. Okay, so we're going to stop here. And then I would say have a good evening, have a good morning, have a good afternoon. Enjoy your day. And it's bye bye.